So CRRT, continuous renal replacement therapy. I don't expect you guys to memorize a lot of the stuff. The book gets into a whole lot of detail. Just really essentially know what it is. Have some of you guys seen this in ICU settings? No? I know some of my group may have. But it's continuous renal replacement therapy. So it's 24 hours. All right? It's a method for treating acute kidney injury. We can use this mostly for ICU patients. So these are for the hemodynamically unstable patient. So that's why we're in ICU. These nurses are very, very, very well trained. As you can imagine, if there's complications, these patients are at high risk for dying. This is not the time to pull out a manual, right? Look at the machine. Can you guys see my slide? It's huge. Have you ever seen one of these machines? They are monstrous, okay? This is not the time to pull out the directions, okay? Okay. So these people, they clearly need hemodynamic monitoring. Very close monitoring. This is one nurse or two nurses even sometimes to one patient. So we're monitoring their vital signs, their cardiac output, their acid-base balance, electrolytes. We can remove large amounts of fluid volume. It's really the same principles. We have venous access, which is achieved by a double lumen catheter, usually in the femoral, subclavian, jugular, most likely subclavian. And it's a pump. It pumps the blood through. Okay, propels around the machine, from the body, through the machine, back to the body. Same kind of principle. It is a very highly permeable membrane they use with lots of fiber, same kind of thing like hemodialysis. But again, it's a hemofilter they use in removing all of the waste products, the plasma fluids, solutes, and they put it into a collection device. And it's quick, 0 to 500 mLs per hour. It works the same way as hemodialysis, very similar to hemo, but hydrostatic and osmotic pressures allow the blood to be cleansed and returned to the patient, coming back through the return port. And they can give medications this way too. Versus hemodialysis, they don't really do that. They can, but generally they can, because it's 24 hours, they can replace your electrolytes through the machine. So again, we were removing our unwanted solutes, BUN, creatinine, potassium. And this allows for our greater clearance of urea. There's less chance, because it's continuous, there's less chance of the filter clotting. They do use heparin in the beginning, before the filter. In most cases, even with hemodialysis, they use the heparin before the filter too. Because usually if something clogs off, it's going to be your filter. Again, these are critical care nurses caring for these folks. And they're monitoring constantly their weight, their labs are hourly, I's and O's, their hemodynamics, so CVP, pulmonary artery pressures. They aren't going to have huge changes in cardiac output because it's continual. So it's very monitored, closely regulated. And the big thing is to monitor the patency of the system. Because you can imagine, if this system breaks down, your patient essentially is not going to live. There's nothing you can do. It's kind of scary. A little bit, right? I have heard of complications with these patients that are very bad outcomes. So, and we're going to watch for the sites, stripped aseptic technique with our catheter care so we don't get infections. And essentially that's about all with CRRT. Just know that it's continual. It's for the hemodynamically unstable patient, and it's patients that are generally with life-threatening conditions. Maybe severe, so they're severely unstable for whatever reason, and have major, maybe electrolyte imbalances and so forth. Okay. So I'm going to stop here.